Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
1991, my father, who you know I adored, we just lost him a year and a half ago, we brought him to Dr. Lederman. You need to bring yourself or someone you know who needs to have the barnacles scraped off their backside to get their rear in gear and walk in there right now because Dr. Gil Lederman is New York's only triple board certified, Harvard-trained radiation oncologist, first brought the non-invasive stereotactic body radiosurgery to America, and he's got the longest experience treating cancer using radiosurgery. So look, do yourself a favor. If it's cancer-related, and I'm talking breast, lung, pancreas, liver, kidney cancers, and more, you got to bring it to Dr. Gil Lederman. He'll send you an informative booklet DVD. You watch it first, you read, you sit down one-on-one with Doc Lederman, and then you prepare for what it is you want to do and you should be doing. Just call Dr. Gil Lederman at 212-CHOICES. Set up that appointment today, 212-CHOICES, or set it up for someone you know won't do it for themselves. At 212-CHOICES, that's 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. Nice to be with you this morning. We are live in the WABC studios. We're talking about things that can improve your health, answering medical questions, maybe ways to save your life. So hopefully it'll be a great hour for you. And if you have questions, please feel free to call us, 1-800-848-9222. 1-800-848-9222. We are live. You can pinch us. We're so live. I want to talk about new news this week, and there was a lead story that was in Wall Street Journal just this week about new ways of looking at women's breasts, and I don't mean Playboy magazine. I mean 3D imaging of the breast to try to find tumors before they can cause harm. There was an article written by Belinda Beck, and she highlighted a study that was from JAMA. JAMA is the Journal of the American Medical Association. 3D mammography is a way of looking more accurately at a woman's breast to try to see if there are suspicious lesions in the breast. Some give the analogy of normal mammography looking at the cover of a book, while 3D mammography looks at the pages. And they quote Dr. Sarah Friedwald, who was the lead investigator, saying if a tumor were hidden on page 40 of that book, we'd be able to see it more clearly than if all the pages were superimposed upon each other. So what was the data for this? Well, researchers at 13 sites compared records of 281,000 women. 281,000 women, a lot of women who had digital mammograms alone, compared to 173,000 who had 2D and 3D mammography. Adding 3D mammography decreased the recall rate. So if you're a woman that's had to go back for a repeat mammogram, going back is less often with 3D mammography, going from about 107 per 1,000 exams down to 91. At the same time, 3D mammography picked up 41% more invasive cancers. So 3D mammography picks up again 41% more invasive cancers. The whole idea of mammography, of course, is to find cancers before they can grow and spread and harm the woman. We know since mammography has been commonly adapted into this country over the last 30 years, the death rate of breast cancer has fallen precipitously, about 30-35%. What's the downside? The downside, well, for the imaging centers, these machines cost about $500,000. We can certainly hook you up to get a 3D mammogram if you'd like to get what's probably considered the best test. So that's not a problem. You just give us a call and we will hook you up. If you've got a lump in your breast, and we've had several women come in this week, in fact every week, people who have felt a lump for weeks or months or sometimes even years, please give us a call. You probably don't need 3D mammography to find this. It's probably easily found and needs to be worked up. So for those of you wanting probably the best way at looking at the breast to find cancers before they are found with other technology, give us a call. We'll hook you up. If you have a lump in the breast, please come in. Let's sit down, stay a while, and solve your issue. We're going to talk in a few minutes about a woman who came in this week. She's been having this lump for more than 6 months and finally came in, and in one day we had everything done, mammogram, biopsy, blood tests, in one day, a few hours. So we can easily arrange things to make your life hopefully healthier and get back on a good course. In the good news department, we had a man, 60-year-old scientist, who was treated more than a decade ago in 2002. We treated him for an acoustic neuroma, which is a form of brain tumor. It's a tumor on the cranial nerve, the 8th cranial nerve. We treated him. He was found. How did someone find a tumor on the 8th nerve? Well, he had decreased hearing, tinnitus, which is ringing in the ears. He had a scan which showed the tumor. Luckily, he came to us before he had surgery, because we know with surgery, most people end up deaf, and a substantial number end up with facial paralysis. So he had totally non-invasive treatment, no pins in the head, nothing like Gamma Knife, which we stopped using that style in 1993, more than 2 decades ago. He had fractionated stereotactic radiosurgery for his brain tumor with us. He's remained completely intact. He's had no adverse effects. He came in this past week confirming all that he's doing very well. We see him every couple of years. Congratulations to him. Congratulations to us for first bringing brain radiosurgery to New York. And we still practice, obviously, brain and body radiosurgery, where we try to hit the tumor, whether it's benign in this case or cancerous in many cases. Radiosurgery hits the cancer. We also saw an 81-year-old woman, an Indian woman actually born in India with 8 children, who had a cancer of the head and neck. She had a massive tumor in the thyroid area. Doctors thought she had a goiter last year. They biopsied it, and actually was a squamous cancer of the head and neck. She was treated elsewhere with standard chemo and standard radiation. It did not work. Then she had chemo at a famous cancer place. Didn't work. She had a new PET scan showing the cancer progressed, and she came to us for radiosurgery. She's an excellent candidate. She has a site of disease. Our success rate in stopping or shrinking head and neck cancer squamous cell is about 90% for the rest of the life of the patient, where we aim the beam. So we certainly told her and her family that information, and they're just arranging everything to get that done. And another patient with a head and neck cancer. So a lot of head and neck cancers are usually cancers of the tissues, not of the brain usually, but they're considered cancers of the nose, the sinuses behind the nose, the mouth, and the digestive upper digestive system, so the breathing and upper digestive system. This is a man that had a cancer of the tongue. He had surgery at a big hospital in Manhattan. When the surgeon operated on him, they cut through the cancer. So how can you tell that? Well, the specimen goes to the pathologist, and at the edge of the specimen, there's still cancer cells. So when there's still cancer cells, it means that on the other side, there's cancer cells still existing in the person's body, which is very dangerous because obviously those will grow. That's what cancer does and can cause harm. So I had a repeat excision, a second excision, which was okay. But then the patient was never sent for further treatment. This was 2011. He came to us. He was left with slurred speech because the surgeons harmed his tongue. His tongue on exam deviated to the right side. That's also, the tongue is a muscle, and it's a symmetric muscle, so if part of the tongue is removed, it won't function properly. So it wasn't functioning properly. It had indications that the surgeon cut through the cancer on the first surgery, and now we did staging of him. That's what we believe everyone should have, is staging, so you know where the cancer is. And now, 3 years later, it grew back in the right same space. So we are offering him repeat treatment, but this time non-invasive treatment with focused beam radiation. Patients come in, get a treatment. We focus on the cancerous areas. And in tongue cancers, this is particularly important because the tongue has a very rich blood supply, and often cancers from the tongue can spread. And we certainly don't want that. We're going to stop now, and we have some new voices that are going to talk about prostate cancer treatment and body cancers. And we'll be back. Again, we're in the studio live if you have questions, so please feel free to call at 1-800-848-9222. Thanks.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and I want to talk just a few more minutes about mammograms again. A lot of women